on highly hazardous pesticides. In fact, this week in Kerala, Thiruvananthapuram, we are going to release a latest report on highly hazardous pesticides. But in India, we have Insecticide Act 1968, it was brought out in 1968, and that is used to regulate pesticides. Now, regulation means there is a registration process, and that registration, that process, they assess the trial data, whatever efficacy of the pesticide, and then approval is given for its usage in India. So now we have 312 registered pesticides. Not all of them are used, but there are registered pesticides. And we did an assessment, and we brought out a list of 100 out of 312 which are highly hazardous pesticides. That's one part. These are very toxic, very highly toxic, and these are used without knowledge and without taking precautions across the country. Second, we have pesticides which are banned elsewhere. So, parliamentary committee was constituted in 2006, and because of that committee, then our government of India reviewed how many banned pesticides banned elsewhere and used in India. So our take is, if it is banned somewhere, so there was science involved in that, and if it is banned somewhere, I think it should be banned automatically in India. But that's not happening. So we are continuously using the banned pesticides, and among them, of course, glyphosate is there. Glyphosate is banned in several countries, but it is still used, of course, in the United States, all these developed countries. European Union is struggling to restrict its usage. So there is a lot of lobbying going around both sides. So we are trying to reduce or even ban glyphosate in Europe. In Sri Lanka, they banned for a while, but due to pressure from the industrial lobby, they withdrew that ban subsequently. But then again they are trying to bring, because they found a direct correlation between CKD, this kidney disease, which they found in Sri Lanka, and then glyphosate usage. I think chronic kidney disease problems are increasing because of glyphosate, and they found that a direct correlation, and because of that they banned. Of course, in India, I think most of you doctors know, CKD is being identified in several places, including in Andhra Pradesh, Sri Lanka, Srikakulam. There is one area, Uddanam, where the CKD cases have been found. And now a doctor told us in Amaravati, in Maharashtra, a lot of these cases are found. And of course in Andhra Pradesh again, newsweed and other areas where both nitrogen fertilizers and pesticides are used, kidney problems are increasing numbers. So pesticides and kidney problems, of course, is one direct correlation.
Sir, there is a study about glyphosate and renal problems, and we had in our Andhra Pradesh area, there was a place in Srikakulam, and exactly. So any work, I think you were also doing something on that. You believe it's only the listed disease, renal, 25-year-old getting small kidneys, and it was is only the pesticides or anything else was there?
It is pesticides, but they have not yet started using glyphosate. There are other pesticides like monocrotophos,
say about the slow cumulative exposure of pesticides, because as a doctor, we used to have abdominal phosphorus poisoning. We used to look into the patient who drink that particular thing. That was an acute manifestation. But when it comes to chronic, slow pesticide, slow, and we are not able to document that. Any thoughts on that?
Yeah, I was coming to that because in 2002, in Warangal, and now in Telangana, we had an episode of pesticide poisoning. This episode is we found at least 30 farmers, they died in a matter of maybe 10 days. And that was reported. So we did a fact-finding visit, and our estimation was at least 500 farmers died. And the death was they just fell off, like what we are seeing with the vaccine deaths. So it was a multi-organ failure, because we have seen at least 8 postmortem reports. And all the postmortem reports said it's a multi-organ failure. So suddenly, multi-organ failure happened, and these people died. And all of them died on the field while spraying pesticides. So that's kind of pesticide poisoning happened. And similar incident happened in 2017 in Yavatmal in Maharashtra. So there at least 200 farmers died, and almost 1,600 farmers were hospitalized in the district hospital. We are not sure how many were there in the primary health center or people who have gone to other private hospitals. So these, most of the deaths again say multi-organ failure. Again, it's not one pesticide. We did a fact finding, it's on our website as well. At least 12 pesticides have been listed, used by all of these farmers. So these kind of episodes of pesticide poisoning, inhalational pesticide poisoning, are happening. In the same year we found it happened in Tamil Nadu, near Hero, and again parts of Orissa. Orissa is another case. We are talking of glyphosate, which is a herbicide. There is another herbicide called paraquat. Paraquat is increasingly was used before glyphosate came in. And in Orissa, Purla, near Sambalpur, there is a hospital, district hospital. There the doctors are protesting continuous usage of paraquat, because they are increasingly finding patients coming with kidney problems and various other problems caused by paraquat. In fact, they sat on 5-day hunger strike asking the state government to regulate the paraquat, because they could not see, they have seen so many patients, and they say we can't do anything to give relief to them. And then this includes suicide, where deliberate poisoning is done, and accidental poisoning, so inhalation poisoning. Now I have two examples, recent examples, which is again very confounding example. In Jalgaon, near Telangana, there was a young bride. She was married, and they went to honeymoon and came back. And on the first day, her husband took her to the field where they were spraying pesticides. She was there for at least 2-3 hours, and she just fell down and died. So that kind of incidents have happened. And recently in Donthi, one woman, she was going back from the field in the evening. So she collected this black jamun fruits on the way. So she took a cover, plastic cover she found there, and this black jamun fruits she collected in that cover, took home, gave that fruits to her grandchildren. 2 of them not know the toxicity of that pesticide. So these kind of incidents, again, are not documented, and of course, nowadays we are seeing preterm births which are increasing in rural areas. We are seeing kidney diseases, cancer, which was not there, it is coming, diabetes, sugar. I know a lot of issues are coming up in rural areas where we think rural atmosphere is pristine and at least enriching atmosphere. But now I feel rural areas are much more toxic because of pesticide usage in agriculture. Glyphosate is, I know, is increasingly used in the last 10 years, and they are used for pre-crop, before the crop comes. They spray on the ground, so that enters the soil also, and that is leading to soil compaction. But then the farmers are not worried because they think they are avoiding manual labor and the expenditure. And then again, we are getting herbicide tolerant seeds, which are illegal in India, but we are seeing that saying the herbicide tolerant seeds and business behind that is growing in US and Europe. There is now a lobby which is trying to get approval for herbicide tolerant seeds in brinjal, in lady's finger, and even mustard. So there is another, so this combination of seed and pesticide companies, only three dominate 75% of the world market. So these people influence the public policy. So we are trying to counter that process through mobilization of farmers and NGOs behind that. And now additionally we are looking at golden rice. I think golden rice is another, I think doctors should know. This gene edited crops are coming. Golden rice is, they said beta carotene deficiency is there across Asia, and they want to supply that vitamin A by modifying the gene of the rice, and that they are calling it a golden rice. We stopped it, trying to put spokes in that for the past 10 years. But last year in Philippines, they got approval and they are going ahead with the production. Bangladesh is also in the, just about to approve that. So once this rice comes, in fact, data says you can get vitamin A, you can get beta carotene, either from carrots or many other vegetables. Instead of promoting that kind of farming, governments are saying, okay, we'll supply you with this kind of vitamins. So there is this gene editing, so they are trying to edit the genetic structure of certain products, and they are saying we are bringing new products, so we don't require any doctor or any medicine to be taken, because these crops, this food can supply you all this medicine. And now in India we have this biofortification of rice. So they are saying in rice they will add multivitamins. So government is now making it mandatory for all the rice mills to add this multivitamin packets in their supply. So for every quintal, they have to add 1 kg of this, and they are saying this will ensure the vitamin availability to the consumer. So this kind of initiatives which transient pesticides, seeds, genetic modification, all that are coming from a certain set of companies, and they try to control this business, and glyphosate is on the top of it. Of course, in the US, for the past 15 years, they have been using, and the recent research shows that more than 50% of the US citizens' urine samples contain glyphosate traces. And recently another research paper said glyphosate can break the barrier, brain barrier between the body and the brain. So the number of research is going on, but still I think our governments are approving glyphosate. In India we try to regulate it, only now it is approved on cotton mostly. But then only for a period of 3 months it was banned in Telangana, Andhra Pradesh and Maharashtra. But that was in 2019, 2020 and 2021. But this year they did not do. So I think increasingly the pesticide lobby is behind that. Finally, I'll just add, because most doctors are here, we had a lot of medical workshops. Pesticide poisoning protocol, once a pesticide poison patient comes to the hospital, the protocol is not developed, there is no standardized protocol. So in India, most of the deaths are happening in the hospital as well because there is no protocol. Of course, I know the antidote for almost all the pesticides is atropinization, and atropine is a plant-based. But then when they come, if they have done, they have ingested pesticide deliberately, inducing the vomiting and what stage it has to be done, and how rapid atropinization has to be done. I think these are all not part of the medical curriculum, and I found many doctors are not aware of what needs to be done when a patient comes in. So we found, I'll give you one example and leave. A girl, she went to her village when there were holidays. So she was, her father took her to the field, agriculture field. She sat on the barn and she absent-mindedly started chewing on the grass blade. She just picked up the grass and started chewing, and she fell unconscious. So they took her to hospital. She had treatment for 15-20 days. She came back. Again she became ill and she was taken back to another hospital. She died 1 month later, and that's because glyphosate was, that bud was sprayed with glyphosate, and she accidentally was chewing on that grass. But that's a very small quantity. I think she could have been revived, or she could have got a better treatment. So I feel pesticide poisoning cases are increasing. In India, there is a National Crime Record Bureau, they collect data, and every year now they are saying almost 15,000 pesticide poisoning deaths are happening. So I think medical fraternity should start looking at the protocol, educating the young residents, and try to develop knowledge and expertise on how to treat these cases. By knowing more about these pesticides, herbicides, and the toxicity which is coming through these pesticides. So I stop here and thank all of you and Dr. Saxena for giving me this offer.
Yeah, thank you, sir. Dr. Reddy, it is all, you understand that practical cases and all that, it's really kind of thing. I just want to put across a small PPT which is created with this glyphosate, and there are inputs from Dr. Senef also. Dr. Stephanie Senef has done the greatest work, I believe, and this is one thing which I always try to get enthused by people like her. The kind of parallel thinking, lateral thinking is amazing. So this is one thing which I thought I'll share with you, because as the last case what Dr. Reddy was telling, the spray, the kind of whatever, even if I I was told, even if you are not putting any pesticides into the soil, but you are spraying that glyphosate over the plants. So that is one big thing. And yeah, this is something, again, this is one of the philosophical things. So the Roundup, which is basically a kind of Monsanto's production and GMO crops. What is this glyphosate? Why I am talking about glyphosate? It is something like spraying on the produce so that there should not be any insects and all that. They should not damage the crop. If that got damaged,
For weeds.
only for weeds. It's a weedicide, yes. It's a weedicide. So this is one thing. It was used like this, and you normally what was told in our integrated medicine and naturopathic doctors always used to tell: don't eat soya, don't eat corn, don't eat this particular thing. Now I understand this is probably because of this particular stuff. And wheat, oats, barley, so many things are on this one, sir. And somehow I developed a problem with the allergy with the chickpeas, and I never knew the safura peas also. You try to get that, but the moment I take that, next day there will be some headache and all. Then I realized, sitting along with you and meditation with you, I need to become a detective, and the way food is a medicine. I happened to purchase a book from Jim Carper. That opened my eyes. Then I started, okay, I don't eat much wheat also now. So I'm slightly scared about all this stuff. So this glyphosate is now the #1 herbicide used in the US and around the world. And I was told it is used more prominently in our part of the world. I think I will share 1 second. I have not yet shared my PPT with other people. 1 second. This is what we are trying to put across, and this shikimate pathway, everything will be okay. And this is share screen. Yeah. So. I think I'm just again you get challenged by this technology. I always find it difficult to match up to the present day generation. And what I was trying to tell was this was offline. It was very clear, but online people, I started talking about what is GMO foods and all that. And what is this thing called glyphosate, and from where, what are the areas, and we just want to go slightly deep dive in and look into what exactly is this. I was, in fact, when I looked at something, canola oil, I used to look into that, what is that? Whenever you eat that different oil, you are into a different cottonseed oil, soybean oil. I think we need to, as doctors, we need to understand that this is causing more harm than good. So there is a talk about this particular thing. The glyphosate was introduced, they said it inhibits the enzyme in shikimate pathway involved in the synthesis of tyrosine, tryptophan and phenolphthalein. I had out of interest, I always now I try to understand the essential amino acids now before everything, because these are the important amino acids: tryptophan, tyrosine, phenolphthalein. Even for sleep you require that. So these are the things which are getting a problem, and this shikimate pathway disruption happens at the gut level. It doesn't happen at the gut. So this all phenolphthalein, tryptophan goes for a cross. Even your thyroid hormones can get affected, as your folate and vitamin K. This is the glyphosate blocks this shikimate to this corismate, which is a precursor for all this right side things. So yes, sir. Yes, sir. Cholinesterase inhibitor is also this one. So I I cannot say how much it is more prevalent here, but I can tell you all the people we used to talk about in the sense we have some areas where we talked about farmers, deaths and all that, suicide among farmers and all that. Is it suicide because of the bank loans or is it because of this glyphosate? We need to understand. We started, I used to have, I was a big fan of using something like oats, and I used to think that it has got very good soluble fibers, and with that my cholesterol will be perfect. So the moment I came to know that all oats has got glyphosate, I stopped. My wife has got a very tough time because she says, now she does one thing, another day it does another thing. So, but I can always, I try to avoid things because being a doctor and trying to understand, it's just actually a tricky thing. And I tell you, sir, if I don't want to venture into something new fruit or something like that, because I try to look it from the up and down, what exactly, I don't even touch a new wine also. I say, no, not for that. I can always have it. So there are big things which are at stake, and I want people to understand. There is a paper showing strong correlation between glyphosate usage and chronic disease. What are the chronic diseases I am talking about? Diabetes. We are living in a country where diabetes is endemic. As doctors, Deva is doing something, I am doing something different, he is doing different something, somebody is talking about a different approach to diabetes and all that. What is needed is to hit at the denominator. This is one thing, diabetes, end-stage renal disease. I was talking about Srikakulam. There was, what is the thing which happened in all these areas is, they studied at one particular, they took a one sample and said, okay, it has got permissible levels, but it is an accumulation which causes. If I tell Chakravarti, one tablet of paracetamol is safe for your body, you agree with that. If 200 tablets, accumulation, it's a problem. So that is the catch here, and we need to work it out. This is IARC declared glyphosate as a probable carcinogen. You have everything. You have sleep disorder, you have autism, you have psychiatric problems. I know Dr. Gurdar is listening very intently with this one. Thanks Gurdar for joining from Malaysia, and I know this is around 3:30 or 4 o'clock in the evening there. Must be around 3:30 or something like that. Good, yeah, coming on Sunday. And would like to listen from all of us. I just want to take the updates from here. And there was a doctor called Professor Don Huber, and he listed diseases caused by this glyphosate. I must say, everything, whatever available here is documented it. And there are areas where they show decreased IQ scores after this glyphosate was introduced in the market. Sir, we believe that even if after blocking, Chakravarti, you are aware of that DDT. DDT was banned some, maybe, Vinod sir, it's banned some 2-3 decades back. Now also, human breast milk has samples of DDT. So, half-life is quite high, sir. Once it enters into your system, it is there in your system. You have got what is that, fixed deposit and all that. Your body tries to conserve everything. This glyphosate in urine was tested. Glyphosate is being tested by GK labs. They do in parts per billion already. They check in parts per billion also. So, glyphosate reduces sperm motility. I thought cell phone and glyphosate is one thing which I always have to talk about. Yeah, and this is a experiment where pregnant rats were exposed to glyphosate, starting at day 9 of gestation, 2 exposure levels, low and high, and neither the rats nor the offspring showed any obvious effect. The second generation offspring from both of them showed delayed growth. The same thing is happening, sir. Even when we talk about lead and all that, there is a lead generation now. The lead which was, it can pass on to your generations also. It passes from mother to child, and there is a linear kind of correlation has been shown. So this is one thing which we start looking. I always believe children are in trouble because they are all into that. They are both into that fast food culture. They doesn't know what is gluten, all pizzas and all that basis are kind of thing, and they have this smartphones. So what is making our children sick was Michael Perros and this. They try to focus on how industrial food is causing an epidemic of chronic illness and exposing the links between GM